It's been probably over a month since I've been out flying just due to all the cancellations last minute that have happened. Definitely packing a little bit different than I normally do. 3 decades of this, and this is the first time I'm packing things like masks and extra wipes and hand sanitizer.
It's Captain Dennis Tager's first day on the job since March.
Pretty empty, no doubt.
He's traveling from Chicago to Miami, then landing in Houston, documenting his trip along the way.
It'll be a little bit harder to find food than I thought.
Giving us a first-hand account of his new reality. In your 30-plus years, have you ever seen anything affect the industry quite like COVID-19?
Not this long and deep. I flew in 9/11 and after. I was in New York, and that was a shock on many levels and horror in an area that I don't think any of us ever imagined. This is a different shock to us. It's invisible.
Over the past 2 months, striking scenes from vacant airports across the country. No long passenger lines, eerily empty flights, and row after row of grounded planes. The number of people flying in the U.S. is down 94% from last year. The 3 largest U.S. airlines reporting more than $4 billion in losses from January to March. Tonight, bringing America back. As the country looks for a way forward, what will it take for the travel industry to take off again?
I have never seen this airport this empty.
Here at New York's LaGuardia Airport late last week, not nearly as frantic as usual, but still people with places to go, like Lauren King from Atlanta. This was your first flight during the pandemic.
It was odd to say the least. It was still pretty surreal just to see everybody covered up, you know, no snacks, no drinks, everything wiped down, handed to you.
Were you nervous at all on the plane?
I wasn't nervous on the first plane, but on the second plane, I was like, oh, I'm on another plane. So I did take out some of my Lysol wipes and just, you know, do a little extra cleanup and everything.
Cameron Coker says he feels comfortable flying because he recently tested positive for COVID-19 antibodies after getting sick in late February.
You know, if you haven't had this yet, I don't know. I don't know if I'd be traveling right now if I didn't know I'd have it. Probably not, honestly.
Kevin Davis is in the Army Reserves traveling to Ohio, where he'll undergo COVID-19 training to then help at New York City hospitals. Are you nervous at all about traveling?
I mean, I'm not nervous because, I mean, if you're practicing, you know, the washing of the hands, the wearing the mask, you'll be safe. I do have 3 masks in my bag.
Kevin and Cameron were surprised to see their planes were not empty, partly because airlines have reduced the number of flights, making the remaining ones a bit fuller.
Pretty full flights, everyone wearing masks.
Arrived in Charlotte. I'm gonna head to the gate now so we can board the next plane.
Landed in Charlotte, super easy flight, nothing out of the normal other than no snacks, everyone's wearing masks. Airport's moderately crowded. Good to be back in North Carolina.
Passengers should expect airline travel to be a very different experience for the foreseeable future. Starting this month, most airlines are requiring face coverings for all passengers. Some airlines also blocking some or all middle seats. United Airlines spokesperson and former Obama White House press secretary Josh Earnest says the company changed how seats are assigned.
We use artificial intelligence actually to seat the aircraft, and we've changed the algorithm to actually ensure that we can socially distance to the largest extent possible on board the aircraft.
Ernest says United has also adopted enhanced cleaning procedures.
We recently purchased 750 electrostatic sprayers. These are the machines that they use to clean hospitals and disinfect them, and we're going to use them before every single flight starting next month.
If passengers don't feel comfortable, what should they do?
Well, one of the things we've done, Gio, is we've actually given our customers a lot of flexibility. So if there are reasons that people feel uncomfortable or their plans have changed, they are able to change their travel plans without paying a fee.
New ways of making air travel safe are emerging. A regional airport in Washington state is now using thermal cameras to test passengers for fever before they go through the TSA checkpoint. Airlines then determine whether or not anyone flagged can fly. You've canceled about 90% of flights. How can the airlines survive?
This is the biggest financial crisis that the commercial aviation industry has ever faced. We reduced our schedule to try to make sure that when demand does start to bounce back, that United Airlines can bounce back quickly to meet that demand.
Despite outrage from critics who felt airlines were mismanaged long before this pandemic, the White House agreed to a $25 billion bailout for the major U.S. airlines comprised of grants and loans. But some are still seeking billions more in federal loans to survive. Is the government funding going to be enough?
The assistance that we received from the federal government was basically intended to cover our labor costs, our payroll expense for the next 6 months. And the truth is, it only covers part of those labor costs for the next 6 months, even including the amount that we have to pay back to the federal government.
Every airplane that's flying today is flying on taxpayer dollars. Government funding for the airlines will run out by the end of September.
Airlines are trying to keep costs down, but still gearing up. The maintenance must be current so the planes can fly as soon as they're needed. At Washington Dulles International Airport, maintenance employees like Travis Alley are working around the clock.
This time last year, every airplane that came in was going out. We weren't storing airplanes this time last year.
Alley says the stored planes require 24/7 upkeep to ensure they're ready for travel when the time comes.
Some of the things we do is run the air conditioning system, and that is to evacuate humidity and moisture out of the cabin so that we don't have an aircraft sitting for a week to up to a month with moisture building up inside the cabin and the avionics equipment. It's not at all like parking your cars, so an aircraft has a lot more components to it than your standard automobile does.
In a way to try to recoup costs, some airlines are now carrying cargo where passengers would normally sit. But some of the safety measures airlines are adopting may end up costing them money.
When an airplane takes off, it has to have at least 80% of the airplane seats filled or it's not going to make any money. But you can't fill an airplane up to 80% and still keep the center seat open, which would allow for social distancing. So at this point, if we're going to maintain social distancing, there's no way that airline and that airplane can fly profitably.
And now, with so many asymptomatic and mildly symptomatic coronavirus cases, questions about whether air travel may have helped spread COVID-19 in the early part of this year.
There are certain individuals that are considered super spreaders that can efficiently spread to many people, while some people may not at all. And absolutely, there are people that are walking around as vectors of disease and don't even realize that they have the infection at all and may never even know.
An ABC News investigation of travel data from December, January, and February found nearly 760,000 passengers came to the U.S. from China, while more than 2.5 million travelers from hotspots like Italy, Spain, and Britain poured in.
Air travel not only is a vector to move a virus from place to place, but it in itself is a place where transmission can occur. You're in incredibly close quarters with individuals. You're definitely not practicing social distancing at 6 feet apart.
The U.S. now has travel restrictions for China, Iran, and most of Europe and North America, but there's currently no limit on domestic travel. There are still questions about how to treat COVID-19 and no national testing program or vaccine, which is why experts say air travel is changing dramatically.
Travel is not going to get easier, it's going to get harder, and it's going to stay harder. The future of air travel looks very bleak. What we knew just a few months ago is all going to change in the months to come, and we may not see a return to normal for years.
What do you say to someone who's concerned and on the fence about flying again?
I don't dismiss it at all. It's okay to have that concern. It's okay to have that anxious feeling about it. That's natural.
For Captain Tager, there's no easy path to getting the planes full again.
If we don't get this right now and we're reckless, if we don't lean forward in the straps, we're going to fall flat on our face in the recovery. And I don't want to see that happen.
For Nightline, I'm Gio Benitez in New York.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.